السلام عليكم طلاب. محاضرتنا اليوم بعنوان There are some terms that you have to know about sterilization and disinfection. The first one is the decontamination. Decontamination is the process of removing contaminants such as microorganisms or hazardous materials, including chemical agents or radioactive substances or infectious agents from an object or a substance in order to prevent the spread of microorganisms and other harmful contaminants that may threaten life of human being or animal or damage the environment. It is achieved by cleaning, disinfection, and sterilization. Cleaning is a process that removes foreign materials such as dirt and organic matters. It must precede the disinfection and the sterilization, and usually done with soap and water and detergent. Talking about disinfection, it is the process of reduction of the number of contaminating or pathogenic microorganisms to a level that cannot cause infection. Some organisms and bacterial spores may survive, while sterilization is the killing or removal of all living things, all living microorganisms, including spores, which are highly resistant. When we need to perform aseptic technique, we have to use the asepsis. It is a process designed to prevent microorganisms from reaching a protective environment, as operation room, the preparation of therapeutic agents, and the microbiology lab. Sterilization of all materials and equipment is required when we are using sterilization and we need to sterilize things. Of course, in surgical and dental procedures, we need to sterilize instrument and gloves, syringe, and other equipments. In microbiological lab, and as the preparation of culture media, reagent, and equipments, there are some factors affecting the efficacy of autoclaving of sterilization methods. Include the physical environment, including moisture, temperature, and pH, in addition to the concentration of the agent, hardness of water, maturity and the state of microbes in the bioburden, the ability, some microbes have the ability to inactivate the chemical agent, so we have to consider this point. Method of sterilization and disinfection, of course, you know that we have physical methods, chemical methods, and gas vapor. The physical methods include dry heat and moist heat, radiation. Sterilization and disinfection method are used in dentistry in order to avoid the transmission of infectious agents such as hepatitis B virus, HIV, and we need to sterilize and disinfect instruments and other equipment in order to protect ourselves and our patients. A number of sterilization methods are available for the heat-tolerant dental instrument, which include the steam under pressure, autoclave, the dry heat, hot air oven, which is widely used in dentistry. The unsaturated chemical vapor also can be used. These methods are preferred for all equipments because they are effective, relatively easy to use, inexpensive, and readily monitored for their effectiveness. The liquid chemical disinfectant or sterilant should be used only when the heat will damage an item. There are other methods also may be useful for the sterilization and disinfection in dentistry, including ethylene oxide, exposure to the ethylene oxide gas, boiling water, ionizing radiation, and lastly the bleach 10% when there is no other. Chemiclaving is the sterilization of chemical vapor under pressure. It operates at 131 degrees centigrade and under pressure 20 IBS and have a cycle time of half an hour. The advantages of this method is that the carbon steel and other carbon-sensitive burrs, instrument, and pliers are sterilized without rust or corrosion. While the disadvantages of chemiclaving is that the item sensitive to elevated temperature, 131 is elevated temperature, will be damaged. Instrument must be very lightly packed, not tightly. The towel and heavy clothing can this method. The disinfection of the dental units and environmental surfaces. The dental units can be cleaned by the disposable toweling by using EPA-registered hospital disinfectant and cleaning agents, such as phenolic compounds, iodophores, chlorine-containing compounds, while the environmental surfaces that are in the clinical contact surfaces, which have high potential for direct contamination from the spray or spatter or by contact with the gloved hands, they are routinely cleaned with soap and water or an EPA-registered detergent hospital disinfectant. Mops and clothes are cleaned and usually allowed to dry thoroughly before you're reusing. You have to prepare fresh cleaning and disinfecting solution. Talking about the procedures of sterilization of disinfection, we know that the physical method include heat, and the heat is the most effective and rapid method. It can cause denaturation and coagulation of the cell protein, bacterial cell protein, and the breakdown of the DNA strand. Moist heat include three methods. Moist heat below 100 degrees centigrade, including pasteurization of dairy product and milk. Moist heat at temperature 100 degrees centigrade, including boiling, steaming, and tenderization, which is the boiling for 3 successive days for 15 minutes for highly contaminated materials. Moist heat above 100 degrees centigrade, including autoclaving. The dry heat, it causes protein denaturation and oxidative damage. Toxic effects of elevated electrolyte, it includes the red heat, flaming, and hot air oven. Another physical method include the radiation by using ultraviolet, UV light, and gamma rays. The other method is filtration, and nevertheless we have the autoclaving. When water is boiling in a closed vessel under pressure, the boiling point of water will rise to above 100 degrees centigrade. At 2 atmospheric pressure, the boiling temperature will be 121 degrees centigrade. But under 3 atmospheric pressure, the boiling temperature will be 134 degrees centigrade. The reactive water molecules will denature the protein irreversibly, and the advantages of this method is that it provides high temperature, high penetrating power of the steam under pressure to the object to be sterilized. When the steam condenses on the article, it will elaborate or liberate the latent heat to the article to be sterilized, and it is not toxic and not time consuming. The effectiveness of autoclaving depends on the absence of air inside the autoclave, and thus the pure saturated steam will be provided, and the excess of steam to the material to be sterilized will be easy. However, there are disadvantages of this method in that the sensitive items to heat cannot be sterilized by this method, and it tends to corrode carbon steel burrs, and other instruments. Autoclaving is used for the sterilization of surgical instrument and dressing, bed linen, cotton, gauze, culture media, which are not designed at high temperatures. Testing the efficacy of autoclaving by 3 methods: mechanical, chemical, and biological methods. The mechanical methods is performed by the daily measurement of the temperature, pressure gauge, and pressure. The chemical indicators that we apply chemicals that will change the color at the end of the sterilization cycle. The biological indicators, we can use the spores of some bacteria that can withstand high temperature but not the sterilization or autoclaving temperature, which are the Bacillus stereothermophilus for the sterilization by autoclaving, and the Bacillus spores of Bacillus subtilis for the sterilization of air oven. We know that the red heat is used for sterilization of biological loop at simple materials. The hot air oven can provide 160 degrees centigrade for 1 hour, or for 2 hours, and 170 degrees centigrade for 1 hour, which lead to the carbonization of organic materials and destruction of microorganisms, including spores. Using the dry heat is for the sterilization of glasswares and metallic instruments. However, the disadvantage of this method is without careful calibration, more chances sterilization failure will occur. Incineration, that we use the more than 1000 degrees centigrade temperature and cause destruction of the contaminated material which are sterilized. Radiation, we have two methods for radiation. The first one is the ultraviolet rays, which is present in the sunlight, and we can produce it in the lab. It is used to reduce the number of bacteria in the air inside the operation room and laboratory safety cabinet, so we can apply the UV light in these parts. It results in the formation of thymine dimers in the bacterial DNA with the loss of its ability to replicate. However, a period of exposure to a visible light may then reactivate an enzyme that will break these dimers and restore the viability or the ability of the bacteria to replicate. This phenomena is called the photoreactivation. The second radiating method is the use of ionizing radiation, such as gamma rays, which is emitted from radioactive cobalt-60, or the beta rays emitted from the electron exciters. It has high penetrating power, and it is used for plastic syringe, catheters, gloves, and surgery. Talking about filtration, we have different types of filtration. Fluid filters for the fluid or biological fluids which are destroyed by heat, such as serum, plasma, vitamins, hormones, or in order to remove bacteria. There are different types of fluid filters, including vacuum or seeds filters, millipore or membrane filters, and the syringe filters. The air filters we can use the HEPA filters as needed to the operation rooms and the safety cabinet. Chemical disinfectants cause death of bacteria. Of course, we have three different levels of disinfection by chemical agents, including high level and interlevel disinfection. Talking about the types of chemicals, including alcohol, 70% isopropyl or ethyl alcohol, used as skin antiseptics. They are protein denaturants that rapidly kill vegetative bacteria. Glutaraldehyde, present in 2% Cidex, it can disinfect instruments that can not withstand heat, such as endoscopes, which act as sterilizing agent when the exposure time is 10 hours. Chlor-releasing compounds, example, the chlorhexidine, the hypochlorite or the household bleach. It is very effective and intermediate level disinfectant, widely used in laboratories and also in the water supply. Besides, it is useful in dentistry. The iodophores, as tincture iodine, they are used in surgical wounds in the concentration 2%. Phenolic compounds as Dettol, Lysol in 2% concentration is an intermediate level and used in laboratories, however, in the work. Quaternary ammonium compounds such as sabilone and cetabilone, they are inactivated by organic matter and they are low-level disinfectant. Hydrogen peroxide, H2O2, 3%, they are high to intermediate level disinfectant used as antiseptic for wound and disinfect the contact lenses in different concentrations. Heavy metal, such as mercury and mercury chrome, they are outlated. Chlorhexidine, safe antiseptic, used for hygienic and surgical hand washing and for oral hygiene. The sterilization by gas is by ethylene oxide gas and the plasma gas sterilizer. Ethylene oxide is highly toxic and explosive and carcinogenic. For this reason, it is used only for plastic and rubber articles, while the plasma gas sterilizer are used for surgical instruments with a narrow lumen, such as arthro.